Every story has an ending, but sometimes it's the beginning that makes all the difference in the world. I was born without trauma or complications. Actually, according to my dad, he said I was the most beautiful baby in the nursery. Of course he said that. I achieved all normal APGAR scores and was given a clean bill of health. While I thrived and achieved in all normal infant milestones, the only one thing that I didn't achieve was walking on my own. However, my pediatrician had an answer for that. He said to my mother, "You have 3 dogs." And my mother replied, "Yes." And he said, "Well, your son thinks he's a dog. He wants to crawl rather than walk." While my mother did not like that idea, but she smiled anyways, she went down a dark and mysterious pathway to find out the real reason why. And to her surprise, I have cerebral palsy, which is defined as a group of physical conditions that affect my ability to walk. To be more specific, I have spastic diplegic cerebral palsy, which limits my movement in my hips and legs. I wear leg braces and use a wheelchair to reach my desired destinations. My intention today is to raise awareness how to treat others who perceive to be different. I guarantee that those of us with cerebral palsy want to be treated the same as everyone else. We also want to have a chance to find happiness and success in our journey in life. There are multiple factors which cause cerebral palsy. Typically, cerebral palsy starts with an unborn fetus. During pregnancy, if the mother develops an infection, the unborn child can develop cerebral palsy. These infections include chickenpox, rubella, or a high fever. Premature births, characteristically infants who are born before 37 weeks, or those who weigh less than 3.5 pounds, have a greater risk of being born with cerebral palsy. Multiple births, which can include twins or triplets, increase the risk of cerebral palsy primarily due to the low birth weights, premature birth factors, and a lack of oxygen to the unborn child. There are several other different types of cerebral palsy. The most common, affecting more than 70% of patients, is called spastic cerebral palsy. There are 3 types of spastic cerebral palsy. Spastic hemiplegia, which affects one side of the body, either left or right, which arm, leg, hand, either side of the body. Spastic diplegia, which affects leg muscles, making them stiff. Spastic quadriplegia, and the most severe type, affects the brain and the whole body movement, where you're wheelchair bound for life. There is also a rare form of cerebral palsy affecting 10 to 20% of patients called ethioid cerebral palsy, which causes uncontrollable movements such as thrashing body or irregular movements in the legs, hands, and feet. Another rare form of cerebral palsy affecting about 10% of patients is called ataxic cerebral palsy, which creates tremors, making it difficult to write, button clothes, or even walk. Mixed cerebral palsy occurs when a patient has more than one type of cerebral palsy. According to the Mayo Clinic, the brain disorder causing cerebral palsy doesn't change with time, so the symptoms usually don't worsen with age. However, there are many noticeable indicators: difficulty walking due to a scissor-type gait, difficulty eating or drinking, delay of speech development, or speaking in general. Thankfully, there are a variety of treatments to help a patient regain some muscle and body movements. Physical therapy, stretching, going to physical therapy, having them just work with the muscles to loosen them. Occupational therapy, which teaches a patient how to do everyday activities. Recreational therapy, which helps to improve a patient's physical and intellectual skills. Speech therapy, which helps patients with speech communication through sign language and even swallowing. Orthopedics, which helps with leg braces, balance, or even inserts in shoes to help the people be able to stand without having pain in their feet, and make leg braces as well, wheelchairs, electric scooters, even walkers. Surgery, which is also available to patients with severe cerebral palsy, which help correct arm, leg, hand movements by lengthening muscles. Surgery can also include cutting nerves and lessen spastic arm, leg, and hand actions. A doctor can prescribe certain medications as well to relax muscles, which aid in walking, talking, and even eating. My story is simple. While I have spastic diplegia cerebral palsy, I was given a chance to live a normal life. My mother never treated me as if I had a disability. Therefore, I had to learn to get up when I fell down and do my chores around the house. I never learned to feel sorry for my physical abilities. A track coach in high school changed my life. With his help, I began competing in track events using a hand cycle. I became an advocate for other high school students who had physical challenges such as cerebral palsy or just disabilities in general that they were not used to opening up about. In conclusion, do we have the right to determine how we treat others by the way they walk, or the wheelchair or leg braces that they use, which enables them to walk? The answer is no. While cerebral palsy affects a person's physical abilities to walk and talk, it does not affect their ability to feel sorrow or happiness. Everyone wants to find inner peace within themselves, the outer success with those around us. I will admit that the statistics surrounding cerebral palsy foreboding. 1 out of every 325 infants is born with physical disability, in which there is no cure. But there is hope. Through physical and occupational therapy, medication, and loving support from family and friends, those of us born with cerebral palsy can live lives we never dreamed possible. There's a quote by Booker T. Washington which became my life motto, and it says, "I have learned that success is to be measured not so much by the position that one has reached in life, as by the obstacles which he has had to overcome while trying to succeed." Thank you.